Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 435,330 confirmed cases of COVID-19 in Canada and 132,800 cases in Ontario. Chatham-Kent has 540 cases and Sarnia-Lambton has reported 434 cases. Michigan now has 415,200 cases, with 22,518 cases being in Detroit. Today we are reporting 104 new cases of COVID-19 in Windsor and Essex County. Of the new cases, 16 are close contacts of confirmed cases, 3 are local healthcare workers, 1 is community acquired, 14 are agri-farm workers, and 70 are still being investigated. We have had 4,342 cases since March. 3,646 cases are now resolved, and 610 cases are active and being followed by our health unit. 32 people are currently in the hospital, and 7 people are in ICU. Our community has lost 85 people to COVID. 56 deaths have occurred among residents in long-term care and retirement homes. There are currently 24 active outbreaks in Windsor and Essex County, 7 in long-term care and retirement homes, 11 workplaces, 2 schools, 2 community outbreaks, and 2 hospitals remain in outbreak. Please do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit close contacts to your household. Keep a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering indoors, outdoors if physical distancing cannot be maintained or if wearing a mask is required. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. Download the COVID Exposure Alert app at canada.ca. Testing for COVID is available by appointment at selected pharmacies and assessment centers. You must call in advance to book your appointment and determine your eligibility. Windsor-Essex has 3 testing and assessment centers: Windsor Regional Hospital Olette Campus, Windsor Regional Hospital Met Campus, and Erie Shores Healthcare in Leamington. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechu.org for further information and updates. I will now turn it over to Dr. Rajid Ahmed, our Medical Officer of Health.
Good morning, everyone, and thank you for joining us again. In September, we reported 2 community clusters linked with social gathering. The main purpose of this cluster investigation typically is to understand how the cases spread within the cluster, identify additional cases that are linked with the clusters but not yet identified, and also to communicate the risk to the public with these type of gatherings and these type of cluster activities. In the last few weeks, we identified another cluster that is linked to sports but spread in so many areas, and we like to share the details for the reason I just reported. So what is a cluster investigation? A quick overview. When we receive a positive case of COVID, of course, we manage the case, ensure that the person is isolated and is followed up by public health and our healthcare colleagues to ensure that their medical needs are met. In addition, it also triggers a contact tracing. We talk about close contacts and contact investigation, but what exactly is a contact investigation, which is a systematic process to identify any unusual aggregation, real or perceived health events that are grouped together in time and space that are reported to a health agency. And it helps us to understand the spread of the disease by identifying all the contacts and the possible infection with COVID-19 due to similar exposures. We also try to identify the ones that are already identified as close contacts, but also try to identify others who may have not been contacted or maybe may have a shared exposure but were not captured, and to provide any appropriate treatment testing guidance for contacts with these clusters. Generally the contexts are anyone who shared living space with the person who was infectious, and that can include all the way up to household contacts, friends, co-workers, and some other settings such as cellmates in the prison system, shelter residents, bunkhouse residents, long-term care home residents, retirement home, schoolmates, and also in other settings such as sports and other activities. So a cluster we identified among Windsor-Essex County's youth athletics community, which was centered around Central Park Athletics, which is a recreational facility located in South Windsor. In addition to hosting a number of teams across all ages and sports, Central Park Athletics is home to the Windsor-Essex County District School Board Sports Academics as well, which provides specialized instructions to students from schools across the city. So far to date, we have confirmed 32 cases that are COVID-19 that have been linked to sports team participating at Central Park Athletics, as well as to the affiliated sports academies at Corpus Christi and LaSalle School, and to their close contacts. As of today, there are 17 active cases, 15 cases have resolved, and 0 are, there is no fatality that's currently associated with that. This is what the epi curve looks like. It's starting all the way from our first case that was reported to us back in November 22nd, and as recent as to December 2nd. And obviously, when we investigated, we found other cases that was tied, and the bars in green is identifying those who were not symptomatic but were tested as identified as the close contacts. So we use the lab testing date as their symptom onset date. With respect to the case characteristics, the majority of the cases were between the ages of 10 and 19, but since there are a number of transmission that happened, which included transmission between the cohorts, between the teams, and with one team with the other, and then within the facility. So there are a number of transmission mechanisms that happen, which I will touch on later on. But I just wanted to give you a flavor of where these cases are within different age groups, and also from which municipalities each of these cases belong to. So as these individuals were participating in these sports activities, and then obviously in turn they are going back to the schools as well, and as a result we can identify that we have at least 7 schools that were impacted by these cases, and these 16 cases attended one of the 7 schools during their infectious period, including 13 students and 3 staff members. And of the affected schools, 3 were elementary schools and 4 were secondary schools. The Corpus Christi Sports Academy, which operates out of Central Park Athletics, was the most impacted, with 9 confirmed cases across 2 different cohorts. An additional 7 cases, confirmed cases, are students at 6 different schools, but these students were not present at school during their infectious period. The cases involved in this cluster practiced and played at a number of different recreation and training centers, including 6 arenas, 2 private training facilities, and 2 golf clubs. Several cases are also linked to a church. 14 confirmed cases involved in this clusters were affiliated with 10 unique hockey teams and included 12 players and 2 coaches. In addition, cases associated with this cluster came from 20 unique households, and the number of cases range from 1 to 5. The transmission pattern, what we have identified as we couldn't identify no single index case within the facility, as there are multiple cases from different teams or cohorts have the same symptom onset date. However, there is some evidence of transmission within and between teams, within cohorts, within facilities, and within households. Within team transmission, several of the affected hockey teams have multiple players and coaches with confirmed cases of COVID-19, indicating that the transmission happened within the team. And then one of the team had 2 confirmed cases, while the other team that they played together had 3 cases together. And although They all have similar onset date, which suggests a possible common source exposure, and the onset date of the players on the two teams are consistent with player-to-player transmission. Furthermore, there is anecdotal evidence to suggest that the players on these teams may interact socially, which is outside of the sports facility and transmission. Then the second part is between team transmission, and there are a number of teams with confirmed cases among their players and coaches who are in the same division and who are believed to have played against each other prior to their onset of symptoms. And there are some specific examples of which team played with which, and then resulting in the transmission from one team to another with the onset date, which makes it possible that they all have a common index source exposure at the same date. Then we have evidence of within cohort transmission, and one of the confirmed case who plays for one of the hockey team was a student at the Central Park Sports Academy through Corpus Christi Middle School and attended schools while infectious. And 6 students from this cohort are now confirmed cases, indicating within cohort transmission. And although one of the student is a confirmed case, they have there is some concern that there may be some potential linkages with their family too. Then we also have evidence within facility transmission and 2 confirmed cases that attended the 2 training facilities on November 22nd, although at different times during their infectious period. And their onset dates of these cases makes it likely that one transmitted the virus to the other. However, it's possible that they were all exposed to a single common index within the facility. Given that many of the confirmed cases regularly attend practices, games, or classes at Central Park Athletics as well as other recreation center in the area, including WFCU Center, Tecumseh Arena, and Capri Pizzeria, within facility transmission through shared space and common personnel is also possible. Then we have also evidence from within household transmission, and we have noticed significant within household transmission from cases to their household contacts that has been observed within this cluster, and 20 unique households are affected by it, of which 9 have 2 or more confirmed cases. In some cases, multiple members of the households are associated with different sports team or with affected facilities. For example, one household of 5 confirmed cases, including 3 players from different teams and 1 coach. In other case, only 1 member of the household is known to be associated with the affected team members. So in summary, this is what the graph looked like. I know it's a very busy slide and it took a really long time for our team to put it all together. We'll try to share that that cluster tree in a different format later sometime today. I cannot commit to a timeline, but we'll try to share that information, recognizing that this is there's a lot of work that went into putting it all together. Lastly, I want to thank my EPI team for doing the cluster analysis and preparing this excellent EPI summary to share with our community. Happy to take questions now.
We'll now take questions from the media. Today we'll start with CBC.
Hi, good morning. Can you speak to what is happening at Central Park Athletics right now? Is the facility still operational given all of these cases associated with it?
So at this time, under the red restriction zone, the facility is only able to have 10 people inside for the recreational reasons, and the sports games are canceled, but team can still come and practice, knowing that the number is still low. We haven't made any specific direction to stop that, but moving forward, this is what the intention is, that we will be putting a stop on all these recreational sports academies at this time until we get a better handle of what's happening in our community. So stay tuned. We will be putting a stop to these type of hockey games or other games that involved many people coming in together.
And what you just shared, that was so detailed, and I'm just wondering, when you saw that map of how the cases were transmitted, what went through your mind about how far it went?
Well, we always try to make those linkages, because obviously it helps us not only from the investigation perspective, but also just highlighting, how these type of events leads to many, many cases. And as we always repeat again and again, that potentially at this time of the pandemic, anyone you're interacting could be a COVID positive person. And the kind of risk that you're putting yourself and to others by participating and engaging in these type of activities, you have to truly understand that. And people may not realize that how a single innocent event can lead to that many cases. So just presenting it outside that the impact of one person. So obviously, when we're talking about the index case, it all take one index case to start spreading, which has resulted in 32 cases, and in all different settings. So if you take any of these settings in an isolation, you would say, yeah, well, you know, it's kind of expected that they're all close contacts, so that's how it happened. But they're all tied to some other activities and then some other activities. So there's a strong linkages all the way around. And it as fascinating it is, it's also it's concerning that people need to understand that you know, when we are truly talking about close contact and truly talking about the risk associated with every event, this is exactly what we mean, that how the communicable diseases spread rapidly around in the community. And the more we understand, the better we will be in taking the right measures and following these precautions.
Thank you.
Any questions from Blackburn?
Yes, this is the second day that we have surpassed 100 cases in our region. I'm just wondering, with the 70 cases that are still under investigation, yesterday we had a large glut of cases that were still under investigation. How long is it taking public health nurses to contact everybody when we have this glut of cases?
So we do have a process in place where we have people contacting everyone that's a case and just giving them the initial direction to self-isolate and indicating that if, you know, and explaining about calling 911 if needed, and that a nurse will be following up with them in the next couple days. So we do have an initial phone call going out to the cases, you know, within a day or two, and then the follow-up by our nurses. So it is taking some time, but we are reaching out to people that do have positive results.
You must be concerned, though, that those people that are secondary cases from the initial one still out and about in the community.
So as people become cases, and if they're living with household members, they're all deemed high-risk contacts, and they would also be advised to isolate. But we are trying to, you know, secure more staff and resources to reach people in a more timely manner and get all of that interviewing done, which does, as I've said before, take some time. But you're right, as people have more contacts, it's important that we reach the high-risk contacts as well and have them isolate and get tested if they have symptoms.
Given the high number of cases under investigation day over day, how many are still under investigation? You don't know where they got it from over, say, the past 2 or 3 days.
So obviously there are a number of cases that are in investigation, and we obviously the method that Teresa is mentioning, we are prioritizing that, and with some of the messaging that we've been putting out in terms of having people prepared to notify their close contacts as well. So if people are identified as a case, we are asking them to go through their close contacts and immediately informing them about the status to self-isolate until the time when public health or our contact tracer get hold of them. The initial contact, sometimes it happens, we get the basic information, and when we are saying that cases are under investigation, it has more to do with some of the additional data that we need to collect to understand the trend. The initial contacts are happening quite quickly, as Teresa mentioned, that just to give them the messaging, and but we need support from everyone who is a case or who is symptomatic to start following those precautions, because the reality is there will be delays in us getting to them, because obviously it doesn't matter how much staffing we put in place. The amount of cases that we have right now, it's exceeding every capacity. So I think we'll just have to be very careful in messaging that, and with our initial contact with all these cases in a short period of time, we're hoping that we can contain it without spreading it further.
I think what I'm trying to get at is, are we seeing a bit of a snowball effect?
Well, there may be, but I guess the bottom line is, I think if the basic message is, don't go out only for essential reason. Limit your close contacts. If you're doing that, there shouldn't be any concerns in terms of ongoing spread. But clearly, a lot of in most of these situations, that is not happening. And that is what it's leading to, most of the snowball effect that you're talking about. But I think the case and contact management, yes, it's a piece, but I wouldn't see that that's the only piece that's resulting in the snowball effect that you're referring to.
Okay, thank you very much.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Teresa, you said there were 85 deaths. On the website it says 86. Can we expect the announcement of another person has died of COVID-19, or is that just a typo on the website?
There is one more person who has passed away. It was a woman in her 70s.
So apparently there is another death. I wasn't aware of that. So
Yeah.
Can you say if she was a member of the general community, or was she a resident of a facility?
And I believe that she was a resident of, she was from the community, a woman in her 70s, and we don't have all the details in terms of the underlying medical conditions, as Mike was alluding to. It just came to us, and I think it was reported, but that's the information that we have at this time.
Okay, and then about this cluster, do you expect any more cases to stem from it?
Well, we do feel that there are still some people who could be incubating. We have identified quite a good number of them. We don't expect that there will be many, but the idea of sharing this is the connection and the possible linkages that people can think of with some of these events. And also, coming forward with any concerns and self-identify test or, to contain the spread. So I at this time, I don't anticipate more cases, but we have seen that sometimes it just continues on.
And you've got 32 cases involving, multiple schools. Can you talk about how much strain this single cluster would have put on public health system and continues to put on the public health system?
Quite a lot, because as if you're talking about the 7 school, that means dismissal of 7 cohorts, and then dismissal of these 7 cohort. Each dismissal of cohort requires a lot of effort on our staff to prepare everything, and then going back to the school and connecting with the school to have everything in place and to dismiss them. It does take a lot of effort and a lot of work. And then on top of that, every time that when these type of cases happen, it triggers an investigation from our health and environmental health team as well. So they have to go, especially if it's linked to any of these facilities, they have to do an inspection and follow up there to ensure that they have everything that they need to keep the facility safe. I don't have a number to quantify, but all I can tell you is it's definitely a lot of work that goes into it, which again, the case and contact management part is there, which we do anyways, but then the trigger effect of dismissal of cohorts, working with the schools and the facilities that are involved, that adds up quite significantly on these investigations.
Okay, thank you.
Any questions from AIM 800?
Teresa, the local public school board posted 2 cases at Essex Public School. Can we expect an outbreak notice from the health unit today? Are they, with those 2 cases, would that cause an outbreak?
Well, depending on the investigation, if they are siblings, so I'm not aware if it's going to result in an outbreak, but we will follow up and at a minimum, the cohorts involved will be released, and if there is a connection or a transmission within the school, then it will be deemed an outbreak. But I'm not sure at this point that it is actually an outbreak.
Okay, thank you. Dr. Ahmed, for the cluster, would this be classified as our 3rd community cluster? I know there was the hubs here and there, but are you classifying this as our 3rd community cluster?
Yes, we're classifying it as a 3rd community cluster that's linked with the sports event in multiple facilities across the region.
When it comes to Central Park Athletics, and I know there was a waiver, because I was there the past couple months. I know there was a waiver you had to sign every time you went in that facility. They checked your temperature. Does your team look at how these facilities are handling, I guess, their COVID-19 protocols and safety measures? Were you pleased with how Central Park handled everything?
Well, I think every time, as I was mentioning earlier on, every time that when we receive any concerns of transmission in these type of public settings, our team of health inspectors, they follow up with the facility. They look at all their plans that are currently in place to ensure the safety of their patrons. So we do look at all of those details, and I guess I cannot comment that we didn't have any concerns or we had lots of concerns, but obviously we work with the facility to make sure that their plan is consistent with what our recommendations are, and what are the areas of improvement that they can do to keep the facility safe. And to your point of even checking the temperature, yes, it's a good practice. If they have the ability to do it, it's great. But we also know that not everyone will present with fever. 70% of the cases will maybe, based on our experience, have had fever, but others may have other symptoms or very mild symptoms that may not be picked up by these assessments.
And with these waivers, not just with Central Park, but any facility that is asking someone to sign a questionnaire, maybe not waivers is the right word to use, similar to what you said yesterday with the border, someone could basically lie, if you want to use that term, or not tell the truth, I guess, and say they're not experiencing any of these symptoms, but they actually are, and they're still going inside these facilities. So sometimes these waivers are not always accurate either.
Yeah, absolutely, and I think it's just one of those additional steps, because many people, we don't even check our temperature daily, or may not even think that we have to do it. But when it's mandatory, or when the expectation is you have to do it, then it forces you to follow those protocols, and it makes you think. And if it's better than not doing anything at all, but yes, it is not. It's not the ultimate defense, if I want to call it. There's always some gaps, and always some people who may not even take that seriously, and then just check off on everything, and don't report anything at all.
Okay, thank you. I have a couple more questions. I'll ask them a follow-up.
Any questions from CTV?
Yes, good morning. Just kind of following Rob's line of questions, could Central Park Athletics face any fines?
I don't think so at this time, because I think there is nothing that we can say that the facility didn't follow as per the regulation that's outlined. As I said, that there are always room for improvement. A lot of that responsibility always comes back to us as individuals, that how we are reporting it. So far there is no talk in terms of anything that requires any issuance of any fines.
And given all the rules and protocols that are in place, is it surprising that there is another cluster that's gotten so large?
Yeah, and that is unfortunate, because I think, I don't know, we've been talking about it every day, and still there may be some confusion, and part of that I will blame the misinformation and the people who are trying to undermine all of these messaging that we are talking about. And it's unbelievable that they are still spreading that, and some, as I reported earlier on, are linked to some of the external governments who are involved in this type of spreading misinformation across the social media globally. And then there are some who start believing on those misinformation, and then it just continue to propagate, and there is no stop to it. So I think there is this this barrage of misinformation that continues to exist on social media, and there is no easy way to battle that. And we always say, come to us, come to our website, go to the credible sources, listen to the experts, what they're saying, and instead of just relying on everything that you are seeing. And I would not hesitate to say that I truly believe that there are people who are intentionally spreading this misinformation to just create chaos, panic, confusion in the societies, which if there's any way to stop that, we should.
And I guess, given the skyrocketing number of cases, have you already talked to the province about lockdown next week, or is that conversation still forthcoming?
Well, we, as I've mentioned earlier on as well, we do provide a very detailed summary to the province every day with our cases, going down into the breakdown of where these cases are coming from, what are the typical areas of concern that we are noticing, what are some of the patterns that we are noticing in these cases, and where are the areas that we need to put more emphasis on. So we are sharing that information every day, and we'll continue to share that information every day.
Okay, thank you.
Any further questions from CBC?
Yeah, further on the lockdown question, I reached out to the Premier's office yesterday and asked about lockdown given what's happening here and after yesterday's record numbers, and they said that public health data is reviewed every week and decisions are made weekly. I'm just wondering, Dr. Ahmed, do you think that that is adequate, or should they be moving faster than that if the need is great?
Well, I guess looking at the data and looking at the evidence is definitely something that we all like to see to better understand the picture. And also on top of that, we also have to recognize that when we are looking at, let's say, lockdown, what additional measures it will bring, and whether those measures are the right measures that would have an impact on the community spread or not. Because if you have cases that is linked to something entirely different, so a lockdown measure, would that change it or not? So I think that's the question that the province deal with generally. Obviously, we report on the matrix that is already identified in terms of the public health capacity, in terms of the hospital capacity, in terms of our weekly case rates, person positivity. So we do share all of those details with them, and getting down into the specifics of how and where these spread is happening, it helps them understand the potential impact of any additional measures and restriction. As I mentioned, maybe moving to a lockdown, if it's happening tomorrow, we may see some further restrictions. But if there are any other restrictions that we need to put in place, either on top of the lockdown, or let's say if we stay here, what additional measures that we need to put locally to contain it. So we are putting all those things together, and we'll wait to hear more from the province. And whatever happens, we will come out with, as I mentioned earlier on, we will come out with our own local restrictions based on the evidence and based on the data that we are observing locally.
And given what we've been seeing the last few days, I'm wondering if you would do anything differently over the last week and a half. Like, would you change the advice that you gave to the province about Windsor-Essex and the potential for a lockdown last week?
Well, I think there's always a hope, and there's always the expectation that when what we are asking people to do, whether they will do it or not. So a lot of that is dependent on the support and the measures that are currently put in place. So we're trying to balance it in every possible way, not only just to put out those messaging, but also making sure that the message is clear, and then also the enforcement piece, that is also clear. So we've been working on that front. We are also looking at what else we can do to maybe address some of the ongoing concerns. We heard about people not coming forward with a positive diagnosis or with symptoms, for the fear of not able to go to work, or for the fear of not having the luxury to take the time off and to care for their family or whatnot. So those are some of the real issues that we like to address too, and try to make it easy for people to get tested, to get the support that they need, and also to help them follow those public health measures. So there are a number of things that we do feel that needs to happen, and every decision, I've always said that every decision that we provide, every recommendation we provide to the community, we do like to see the impact, the intended consequences, as well as some of the unintended consequences, and we try to balance those. Obviously, my weight of decision always goes on the health side, because that's my job to take care of the health side, and we'll continue to do that. I don't think that if I have to go back, I would change my recommendation, because that was the recommendation based on the evidence that was available at that time.
Okay, and just one last question. On the cluster, I know you weren't able to identify the indexed case, but is there a date that you can approximate when it all started?
So the earliest symptom onset date, I mentioned it was November 22nd. That was the earlier onset date of this cluster.
Okay, thank you so much.
Any further questions from Blackburn?
No, I'm good, thank you.
Any further questions from the Windsor Star?
Yes, Doctor, I'm wondering if you can comment on what's happening right now on the agri farms. We have 5 with outbreaks, 14 farm cases today, and considering the number of cases that remain under investigation upon reporting every day, I'm sure we're seeing a few more farm cases than are reported during the daily update. So what are we seeing on farms right now? Is it the beginning of a repeat of the first wave, or is that situation under much more control?
I would say the situation is much more in control because of the additional measures that are currently put in place by the employers. Many of them are doing a lot to keep their workers safe. And obviously, when you have that much high level of community transmission happening, so it's possible to see the spillover impact on some of the other industries too. So this is exactly what we are seeing, and the number of cases that we are seeing in the agri farm so far is still it's increasing. Obviously, the number of close contacts, that's the most problematic for all of us, because then they need isolation spaces, and then We know we have some challenges with our isolation spaces. We are getting the funding support from the federal government, but that needs to be renewed regularly every 30 days. And we have sent an application, I believe yesterday or the day before, to our province to request for further extension. So this is an ongoing issue that we have to deal with, which creates a little bit more complications. But so far, the agri-farm cases, I would still say that it's not to the point that that's our only problem. Our problem right now is the community and the cases in the community and the pressures on the healthcare system.
Okay, that's everything. Thank you.
Any further questions from AM 800?
Dr. Ahmed, just following up the CBC question in regards to lockdown restrictions, the local restrictions that you plan to announce, will you be waiting to see what the province does, or will you be announcing them at this time tomorrow morning?
Well, I think that the most logical sense is to wait to hear from the province, because if I'm announcing those restrictions and let's say if they decide to move us to the lockdown, it doesn't make any sense. So I'll wait for them to make that announcement before we move forward with any restrictions locally.
Okay, thanks for that. And we're also hearing that a number of jail guards at the Southwest Detention Center have tested positive after hosting American Thanksgiving football party. Can you confirm if the health unit is looking into that, or if a number of jail guards have tested positive?
So obviously at this time, I cannot confirm any of those details. All I can assure you and the community is, just like I presented this cluster analysis, we always look for that that common link, exposure source, and then do our work to do our investigation and contain it as best as we can. If there is any connection that we feel that would require a public disclosure, we will do that. But other than that, we try to respect everyone's privacy, and then also always try to look out for the people, and any risk to the community, we always have erred on the side of caution and share that information.
Okay, thank you. And then one final one here, just in regards to LaSalle canceling its Santa drive-through event on the advice of the health unit. Can you tell us why the health unit, gave that advice for the municipality to cancel this event?
Well, our recommendation has been consistent. We generally, we don't get into the specific details of each, what event should be allowed, what event should not be allowed. Our general recommendation is any event that's bringing people together should not be allowed, especially in the red control zone restrictions. The recommendation is people should go out only for essential work and essential reasons. We recognize that it's challenging, it's a difficult time, but we also don't want to create confusion that when we're talking about essential reasons and what is essential versus what is not essential. So our recommendation goes only that far, and obviously the specific event, there are some provisions under the regulation what can be done and what cannot be done. The River Santa Parade, it's in the regulation that how the province gave the advice to conduct it safely. It's out there, but the general recommendation from public health will always be to avoid any event that brings a large number of people together.
Has Amherstburg reached out to the health unit in regards to their river lights? I believe it kicked off late last month or earlier this month. I know it's out in two parts and people are out and about. They have mask requirements now, but has Amherstburg reached out to see if they should pull the plug on their event for the remainder of the year?
So all I can tell you, Rob, is we do meet with the municipalities, CAOs regularly, and we provide those guidance. Sometimes we receive very specific requests. Sometimes we receive more of a general advice or question that we answer. as I mentioned, if there's any specific question, our team responds with the specific answer. If there's a more general question, we answer in the best possible way to keep public health as a priority and following the regulations.
Thank you.
Any further questions from CTV?
Yes, just one more. Some Windsor-Essex-based leaders are canceling in-person Christmas services. What is the messaging for churches during the Christmas time, and what should they be doing?
So I think under the red restrictions, there is a capacity limit to these places. Other than that, we haven't put out any specific recommendations for the churches or for this religious services announcement. So I think we'll have to wait and see if there's any provincial direction comes in. If not, then we'll have to rely on what's allowed and what's not allowed. And obviously, it's good to find the right balance of how you can balance the risks and also provide a service which can be virtual, which can be so many different ways to support the community.
Okay, thank you.
Thank you, everyone.